My name is Eric Dede. I am an emergency physician in the Boston area. There's just no frame for comparison. It's just nothing like we've ever experienced.
My name is George Kinsvogel. I'm Chief of Cardiology at MetroWest Medical Center. We've repurposed the entire hospital infrastructure to treat one disease. We've never done that before.
It wasn't that busy until last week when it started to ramp up. Each day has been busier and busier.
Vulnerable patients, patients who are on blood thinners that need monitoring, that still need to come into the office, and we need to do so in a way that both protects our patients and protects our staff and protects the doctors and the nurses that work in our office.
I put on my gear and I go as many hours as I can until I have to go to the bathroom, and I chug down a protein shake, chug down some water, put everything back on, and then I go back out in the trenches.
So this is a real, ethical, moral, emotional, struggle for people in that their loved ones are in the hospital, they're being cared for, they know that they're getting excellent care, but they can't come see their loved one. And, that's applying to, everything.
But that's not what we're used to. I'm used to sitting next to the person, holding their hand, putting my hand on their shoulder. There's that human touch that makes people feel reassured about the care they're getting. And if you don't have the ability to do that and you just talk by phone, it just feels much more cold, I guess. The interaction is cold. And so much of medicine, there's a science to medicine, but then there's just the human reassurance that if a patient is feeling reassured, they feel so much better. They tend to get better.
Women giving birth, one person can come in to pick up the mom and the baby when they're ready to go home. So that a lot of the things that we have taken for granted in terms of, human, important milestones in life have really been disrupted.
There's been a lot of, a little bit of angst about me going to work, do I need to move out? Do I need to stay somewhere else? Do I need to quarantine myself in part of the house? So I have a kind of a decontamination process when I come home. I change clothes at the hospital first, get out of those clothes that I was wearing and shoes, put on a new pair of clothes and shoes to come drive home. And then in my garage, I take those off, and then I dash around to our front door in my underwear, up the front steps to a side guest bathroom where I take a shower. Long hot shower to try to decontaminate, and then and while my kids and dog are trying to come say hi to me, I gotta keep them at bay for a little while, and then I come out and I feel like that's the best I can do to keep the virus out of our house. We love what we do, and we do it for a reason, and you have to drag us out of the ER to make us not work again.